Welcome to GutTalk TV by DAB, a YouTube channel focused on closing the communication and knowledge gaps in gut health. Please press the subscribe button below. Hello everyone, I'm Dr. Jakob.
Hello, I'm Dr. Yoon. We are gastroenterologists from Australia.
And we've been getting a lot of questions lately from our patients about the social media trends on certain diets and supplements with respect to COVID-19.
And we are here to address some of those issues. So, Dr. Bigan, we've been asked a lot of questions about vitamins and how it's going to help with the COVID-19. So, what's your thoughts on vitamin C, which is known to be super vitamins that might help with the COVID-19? And some countries use vitamin C as an IV dosing for treatment of coronavirus. What's the evidence behind use of vitamin C during COVID-19?
So, we really don't have a lot of evidence about vitamin C and COVID-19 at the present time. However, it has been used in many trials of other viruses like the common cold, influenza, and other respiratory infections. What we know from those studies is that it doesn't tend to prevent you from getting an infection. However, if you acquire an infection, it does seem to make the symptoms a little less severe and also last less long. With respect to COVID-19, there have been some trials using very high-dose vitamin C given intravenously to treat some of the severe inflammation that we see with this disease. Those trials are still underway and we don't yet know the results of them.
And what happens if people hearing this decide to go out there and take a lot of oral vitamin C tablets to achieve the similar effect? Should they do that, or what's the side effect that can come with it?
That's a good question. So low-dose vitamin C is very well tolerated and safe. However, higher doses of vitamin C can be associated with a range of side effects, including gastrointestinal side effects most commonly like nausea, abdominal pain, or diarrhea. So I would stick to low doses in the range of 100 to 200 milligrams.
I see. And other than that you have mentioned, other than tablet form or from the intravenous form that you're getting at the hospital, is there any natural way that you can consume vitamin C?
That's a good question, and there are plenty of foods that are naturally rich in vitamin C. These include citrus families such as limes, lemons, or oranges, as well as kiwi fruits, and also some green vegetables such as broccoli or other green leafy vegetables.
Excellent. So we can move on to next alphabet, vitamin D. So also people believe that vitamin D deficiency is associated with a lot of other chronic diseases. And there's also a few social media trends saying that taking vitamin D tablet helps with COVID-19. What's your view on that?
Well, vitamin D has been a very popular vitamin for a long time, both in its main role in terms of improving bone health, which it's still important for, but also because of the vitamin D immune hypothesis. Vitamin D in the lab and in animals can be associated with a variety of beneficial effects on the immune system. In human trials, although these are smaller trials than with vitamin C, there have been trials looking at the role of vitamin D replacement in patients and the effect on infections. And in this case, we do see an effect of decreased infections and decreased intensity and duration of symptoms from infections, but mainly this was restricted to patients who were actually vitamin D deficient. And as you pointed out, that's associated with a variety of chronic diseases.
So people then can think, just speaking for the audience, they can just say, okay, I need to go to GP and test for vitamin D deficiency. Should they do that?
Oh, that's a good question. So there was a trend a few years back of testing everyone for vitamin D deficiency, but that has really pulled back a lot now. And I would say that if you're not at risk of vitamin D deficiency, then there's no need to be tested. People who are at risk include people who don't get enough sunlight, which is a natural source of vitamin D, have other chronic health issues, or have some dietary restraints. With respect to vitamin D supplementation, I would recommend sticking with a low dose because of side effects, as we talked about before, and a standard dose of 200 to 400 international units found in a multivitamin should be sufficient if your vitamin D levels are good. If your vitamin D levels are low, then a dose of 1,000 to 2,000 international units would be adequate. And as long as you're staying within these dosing ranges, there are a few side effects.
Okay. And is there another natural way that you can get vitamin D other than tablets?
Sure. So as we mentioned, vitamin D is made naturally by the body through activation by the skin and sunlight, but you can also find the vitamin D precursors that are important in natural sources such as eggs and fish.
The other thing will be, you mentioned that sunlight is a natural source of vitamin D, and it's a bit hard with the COVID-19. Social distancing really limits our exposure to sun. And also, interesting, vitamin D deficiency is associated with depression, which we are thinking after COVID-19 calms down a little bit, that will be the second peak of depression. Is there any precaution that people should take?
So I should just specify the amount of sunlight that we think is necessary to provide your body with its daily amount of vitamin D is about 15 minutes. Just on the forearms is enough vitamin D to get all of the activation that you need. We are worried about overexposure to sunlight, especially in Queensland, where we are, because of the high rates of skin cancer. And as far as depression goes, we do see this association with low vitamin D levels and depression, but that's more likely the fact that people with depression are less likely to get the sunlight and the full diet that they would need to have good vitamin D levels. And studies that have looked at replacing vitamin D levels in these patients has not really had much of an effect on depression.
Then we'll move on to another alphabet. So we got alphabet A and B and E, which is the next topic online. What do you think people should be doing, and should they be worrying about replacing those vitamins?
So when we talk about some of the other vitamins, like vitamin A, the B complex vitamins, and vitamin E, there have been a variety of studies that have shown low levels of these vitamins are associated with increased risk of infection. But again, these are associative studies and not necessarily causal, which is to say the low vitamin levels don't cause the immunodeficiency, they're just all associated with chronic illness. So while we think it is important to have good levels of these vitamins for general overall health, we think that you can generally get that through a well-balanced diet and that you don't necessarily need supplementation with these vitamins. If someone really does want to supplement them, then the amounts that are in a typical multivitamin would be adequate.
And again, the same question of natural way of getting those vitamins?
Yeah, so we want really a whole diet. So these are green leafy vegetables, whole grains, and also legumes and tofu contain a rich supply of all of these vitamins.
All right, so just summarizing what Dr. Bigan's been telling us about vitamins associated with the COVID-19. So you don't have to routinely go and test for vitamin deficiency unless you think you are at risk of those vitamin deficiencies. However, supplementation can be helpful, particularly in patients with known vitamin deficiencies. When you take vitamin supplements, low dose is always a safer option. However, if you require to take high dose supplementation, you should talk to a doctor and do that in a very monitored environment. And it's always good to take those supplementation from the natural source, which is our natural whole food, which is a good source of all the multiple vitamins actually.
Okay, Dr. An, we've talked a lot about vitamins, and I think we'll switch now to another type of supplement, and that's minerals. We'll go all the way to the end of the alphabet, to Z.
That's right.
And talk about zinc. So zinc, I think, has been touted for a while as being an immune mineral, if you will. Do we have any evidence that zinc might be helpful with viral infections like COVID-19?
Well, zinc there's no direct study that showed that zinc was helpful with COVID-19, or it was no study done in the COVID-19 setting. However, we know theoretically that zinc is good with anti-inflammatory properties and also antioxidant properties. People usually take zinc tablets, and that has shown that it reduced the amount of time that you have a common flu. However, it didn't really show that it reduced the risk of infection as such. So yes, you can take some zinc tablets, but it doesn't have a strong evidence around the viral infection risk.
And what about taking it other ways apart from tablets?
Yeah, interestingly, there are other ways of taking zinc. First will be lozenges that people usually take before overseas travel. However, the study actually look at the lozenges as opposed to tablets, show the lozenges is ineffective, even reducing the risk of reducing the time that you get the common flu symptom. So I guess you want to avoid lozenges if you want to. And the other thing is a nasal form. Strangely, never heard of this before, but some people stuck the zinc up their noses, and this one can cause to have potential effect for losing sense of smell. So that's not the side effect that you want to expose yourself to, so I will avoid that too. So zinc tablet is probably the safe form, or even the natural source if you can go for that too.
Are there any problems if we have patients taking high doses of zinc?
That's a very good question, Dr. Bigan. So a high dose of zinc can be have undesirable effects. So you can reduce your immune system as opposed to immune boosting property that you want to achieve. So low dose is what's recommended. So less than 100 milligram, which usually comes in multivitamin form, that's enough.
And any natural sources of zinc that patients can use?
Zinc is readily available in a lot of seafood, especially oysters. However, it's also available in red meats and white meats like chicken and stuff.
Okay. All right, let's switch from minerals then and talk a little bit about supplements. And there's a couple of supplements that have been in the news lately, especially around COVID-19. And one of those is elderberry.
Yes.
Yes. What are the properties of elderberry that make it an attractive supplement for COVID-19?
So some of people never heard of elderberry like I did up until COVID-19. Elderberry is a berry from elder plant. And apparently it's been existing for a very long time and known as a superfood, and the property is really reducing the inflammation. So people have been using for common flu symptom. However, there's not a strong study that's out there that's I can provide you evidence for, but people did say, like zinc, it shortens the duration of the symptom, but it doesn't reduce the risk of viral infection. And of course, because of this lack of study, there's not much study available for COVID-19.
And are there any risks with too much elderberry?
Too much elderberry can have a side effect, like everything else in the world. So if you have too much elderberry, then you can have neurological side effects such as weakness in your arms and legs. You can have some gut side effect, which can be nausea or diarrhea. And just like a food allergy, you can have allergic reaction to elderberry.
And what forms does it come in if people wanted to take the supplement?
Yeah, so if you are not a tablet, so it comes in capsule form. But if you don't want to, it comes in a natural way, it's like a syrup, or it comes in wine form too.
Sounds delightful. Okay, so next supplement on the list that we've been asked about is echinacea, and echinacea has been around for a long time.
That's right.
With the common cold, etc. So what is the evidence actually for echinacea in viral illnesses?
So even though it's been commonly and widely used supplements, there's not a strong evidence that just tell us whether they reduce the duration or increase risk of decrease of infection. However, they say it reduced the symptom severity. I think it's more where the focus is. So yes, you can use it, but I'm not sure 100% how much of those studies are placebo effect as opposed to real effect. So it's a bit hard to say the real efficacy that you are taking this for COVID-19.
And what is echinacea? Where does it come from?
Interesting. So echinacea is it's a flowering plant. It's from the daisy family. And how do I know this? Because I recently Googled it. But that's apparently you can use a root and the flowering part, both of them, for the echinacea supplements.
Okay, and are there any side effects that people should watch out for if they're taking this at home?
Yes, only it's very similar to elderberry, like neurological weakness and GI symptoms, nausea and allergic reaction. But one thing to keep in mind is not like all the other supplements that you usually take usually causes diarrhea. This one causes constipation. So if you're taking this and you notice constipation, maybe you want to stop or reduce the amount of taking it.
Very good. Okay. So if I can just summarize what we just heard Dr. An talking about, with respect to zinc, this does have some immune modulating properties with minimal side effects at low doses, but of course with higher doses you can see side effects. And with the natural supplements that we spoke about, namely elderberry and echinacea, these might have some antiviral properties in terms of symptom lessening. However, the evidence base is not that strong, and in addition there can be side effects of taking them at high doses. Okay,
and we can't just stop here, Dr. Bigan. We have a few more questions. So few questions that have been asked from the patients about garlic. So whether they should be taking more garlic or they should take some garlic tablets because they heard that it's very good for immune system. What's your thoughts on that?
Well, garlic has been around for a long time, and its beneficial properties have also been touted for a long time, back from the Middle Ages when we could get rid of vampires with garlic, to a more modern age where we've been talking about its antiviral properties. The actual evidence for garlic and its immunological properties is extremely limited, but that being said, it is a natural food and generally very safe, although I will point out to some patients out there that garlic can disagree with your tummy, and a lot of people find that too much garlic can cause tummy aches and bloating.
So you can keep the vampires out, but not the virus.
Maybe not.
And also interesting, in some countries like in Asia, in China, they promote the people to take more milk and more egg products. Is there evidence behind that recommendation?
I think that's interesting. And we probably know from our own practices that sometimes people also have sensitivities or allergies to milk and egg. We think about it as an immune function in the other way. But perhaps one thing that I would mention is that both milk and eggs are a rich source of protein. And during times of infection, your body really requires a lot of more protein than usual in order to fight off the infection and mount a good immune response. So if you are sick and having symptoms of viral infections, having a diet rich in proteins is beneficial.
And I guess the next question will be cow's urine. I know there's not much evidence for it, but we've been hearing about it. What's your thoughts on that?
Yeah, we have been hearing about it, and I don't know that I have anything to say on that matter. We might leave it for that.
All right. I hope you found this guidance useful. If you have any questions or concern, please leave a comment below and we'll try to address it.
And most importantly, please stay safe. And for more GutTalk TV updates, please press the subscribe button below.